Baldwin. Senator Cassidy.
Hey, thank you all three for the good work y'all are doing. A couple things. Dr. Shuka, Pan American Health Organization, World Health Organization, we're kind of speaking about this as if it is a U.S. issue, which Dr. Fauci, with his great work, is always going to be looked to internationally. On the other hand, frankly, Pan American and World Health should be point on this. You may, I don't know if you feel honest or not, but how are they being point? Or are they, how's their response been?
I think the World Health Organization has really taken to heart the critiques of the Ebola response and is being much more visible and trying to get ahead of this. The Pan American Health Organization is quite strong in terms of regional coordination and scientific capacity, and they have been working very intensively. We've worked together with them on laboratory workshops so that all of the countries of the Americas can be trained and ready to diagnose this virus. So I think the world is trying to be more prompt and coordinated at this point.
And let me ask, you mentioned in response to Senator Collins regarding the influenza, and you mentioned models of predicting flow, and we all know that it starts over in Australia, China, and then sweeps. Now, Dr. Fauci in a publication has this kind of hotspot of all these diseases that are popping up. What I am unclear about is why we know that people moved from Africa, Asia to the Pacific Islands. Anecdotally, there are Pacific Islanders were traveling to Brazil. Now, as sure as the sun rises in the east and sets in the west, we were going to have Zika in Brazil. So it seems as if this would have been predictive with big data, with cell phone data. Where are cell phones being used from one country to the next? I have no doubt that there's a federal agency that tracks this, if only for security purposes. Where are we coupling the kind of new movement of Fauci's chart with somebody's understanding of where people are moving in order to anticipate these as opposed to finding out about them after we start hearing terrible reports?
Yeah, thank you. The prediction capacities are much greater than they had been. And for example, chikungunya, another one of these mosquito-borne viruses, was not in the Americas till recently, but we predicted it was coming and we prepared for it with diagnostic tests and outreach efforts. The different thing with Zika is I think we expected to get it in the Americas. We never expected the birth defect issue. The good thing though, I'm sorry, but the good thing about our preparedness is when we went to YAP in 2007 to respond to that outbreak, our laboratory developed a diagnostic test. So when the problem emerged in South America, we already had a diagnostic test sitting on the shelf.
But you mentioned earlier that the dengue fever, that the dengue, I think it's dengue and Zika actually cross-react.
That's right.
And so it's a test, but it is a poor test if you have a broad background of dengue prevalence, correct?
There are two different kinds of tests. The polymerase chain reaction
Would be
test
specific.
is specific.
But more expensive and less accessible.
Well, no, the problem is it's only positive when you have symptoms during that one
Gotcha.
week. We're working on a more specific antibody test that will help differentiate, but right now that's a problem.
Because one of the things that's clearly quite likely, since there's a similarity of symptoms between these different viruses, that we're overstating the intensity of the Zika relative to its actual, if we have a cross-reaction of test and we have a background of all these other illnesses, hard to imagine that we're not overstating the intensity of Zika because we're aware of it and our tests are less specific. Fair statement?
Well, in the Americas, they're actually testing for all three. So we know that in Colombia, for instance, there are thousands of cases of dengue right now, but then there's also, or of chikungunya, excuse me, but then they're also seeing this big emergence of Zika. So where they have been looking, they can differentiate with the PCR right now.
Dr. Fauci, the NIH obviously is going to be funding this. Is there a rapid, has NIH set up a rapid funding mechanism where, as opposed to the normal kind of several week, several month process of review, boom, the dollars are going out more quickly?
Thank you, Senator. That's a very good question. And what we've done is that, fortunately, we have a portfolio of a considerable amount of grantees and resources on flaviviruses in general. So we had a number of grantees both in the United States and in Brazil and other South American countries who were grantees for dengue, other types of flaviviruses. So we supplemented their grants like that. So we were able to not go through the months-long review process. We were able to do a truncated process to give them a supplement to their grants at the same time that we're putting funding opportunity announcements out to go through the normal grant process. That's the reason why we were able to jump on this very quickly. The other thing that we did is that it so happened that our intramural research program, the Vaccine Research Center, who developed the Ebola vaccine, are there intramurally. So we just told them to turn around on a dime and start working on Zika, which is what they did. So we had two mechanisms going that were much, much more quick than the usual grant months and months process.
Got you.
Right.
Thank you. I yield back.
Thank you, Senator.